Well, a recent report from KFF says premium payments under the Affordable Care Act could double next year. That's if enhanced premium tax credits expire. Those have been a point of contention on Capitol Hill during the government shutdown. Let's bring in IU professor Kosali Simon for our unfiltered conversation tonight. Professor, good to see you. How big of a jump are we talking about?
Thanks for having me. It's a big jump if we consider what people would pay out of pocket. We have to keep in mind the amount people are paying out of pocket is very dependent on how much the government fills in, because premiums are expensive and are rising.
Explain to our audience how enhanced premium tax credits work.
So when the Affordable Care Act was passed, there were subsidies built in, and those were in effect all the way through 2020. In 2020, with the COVID assistance bills, we saw generosity increase towards many social insurance programs, unemployment benefits, child tax credits, and they also increased for the subsidies, the amount that the government would help people pay for the premiums on the marketplace. As we know, many of the other assistance types of extended unemployment benefits, those went away, but the premium subsidies continued and were extended till 2025, December. So what that meant is that people paid even less than they would have under the regular subsidies that the Affordable Care Act provided. And so the question now is, are we going to have these extra subsidies continue past 2025, or are we going back to the way the subsidies were when COVID started in 2020?
So explain a little bit more how they're tied to the premium payments, if you can.
Okay, so the way that the subsidies are structured, they basically tell people you will not have to pay more than some share of your income. And so it will be depending on your level of income, but it might be about 6% of your income. So what that does is it caps how much you have to pay, and then the government pays the rest. What that means is if the subsidies continue as they are, even when the premiums increase, we wouldn't see a lot of that coming out of our pocket because the government takes the extra payments. But if the government cuts back the fraction they will pay, so we would have to pay more as a percent of our income. If that's happening at the same time that premiums are increasing, that's the double whammy people are talking about might happen going into 2026 if the extra subsidies expire, especially because we've seen insurers are increasing rates for 2026.
Are there any alternatives if those tax credits expire?
If the tax credits expire, then we still are going to have a substantial amount paid by the government towards the subsidies. The subsidies will be the structure they were before the extra added, but it will come at a time when the premium sticker shock is going to hit because of those extra amounts. Now, depending on whether somebody has an employer plan or if their incomes are low enough that they would qualify for Medicaid, there are other forms of health insurance. And there are lots of other ways people have been talking about how there might be alternatives like stepping down from, let's suppose it's a silver plan somebody was buying on the exchange. You can reduce your premium payments by going to a bronze plan, a plan that has more cost sharing, a higher deductible, a higher co-insurance rate. And so there are some alternatives we've seen people writing about.
Okay, well, Professor, thank you so much for joining us and trying to figure it all out. Lots to get to on this one. So again, thank you for joining us for Unfiltered.
Thanks very much for having me.